The Unconventional Therapist's Guide to Nothing.
Hey everybody, welcome to The Unconventional Therapist. I'm Dave, and I'm here with my co-host, Greg. Greg, it was your birthday yesterday. I totally forgot to acknowledge it. I just did, though, so that makes up for it, and I am a good friend now.
Thank you, Dave. I'm pretty sure I mentioned it before you kind of said anything about it.
You did, but then I said the date because I knew the date, so that means I remember things.
I share that special day with Ving Rhames and Emilio Estevez.
Which one are you more excited about?
Ving Rhames, baby boy. I'm a huge Ving Rhames fan. I guess.
You say Baby Boy?
Yeah, he's in that movie Baby Boy.
You saw Baby Boy?
Yeah.
What? I've seen that movie a lot, actually.
Me too. And I don't know why.
I really liked that movie.
So do I. It's severely underrated. Jody?
That is crazy.
Yeah,
that me and you both actually like something and is the most unexpected thing you could ever imagine.
Neither one of us has
Tyrese
any
plays
business
Jody.
liking it. It does not fit with anything.
What is her name?
Jody.
Taraji B. Henson. Isn't she his girlfriend in that?
See, that's that's a secret crush of mine. Yes.
Yeah.
And what's his name again? Stunningly handsome. Part of the Bald Brotherhood. He's Jody.
Tyrese,
yeah.
Yeah. And the soundtrack to that movie is fire.
It's so good. Such a good movie.
Wow, that just blew my mind. You know what's so funny? I have to share this because I was thinking about this today. There's two types of people when it comes to music, and it made me think about the very first time. I think we might have still been in school, and I asked you, like, what kind of music do you listen to? There's people that listen to like classic bands and or whatever, but that's all they listen to. So in a way, they're essentially just listening to the same songs over and over and over.
Yeah.
And then there's people who love to explore and find new music and find new artists and up and coming artists. I'm kind of more that, but I also do have some favorite like older bands that I definitely love exploring new music. And you are the exact opposite.
Well, no, look, lately I've been like Magellan exploring new music. And you know what the catalyst for that is?
I'm going to say I don't get the reference. What did Magellan have to do with new music?
He's an explorer.
Oh.
So let's not get into that. Circumnavigated the globe, no big deal. But anyways, because Instagram now with the reels.
I thought he was a wizard.
And it's not a Merlin. And I think there was some kind of wizard named like that near that name in Eureka's castle, but now we're getting really obscure.
I think that's my reference.
Yeah, we're getting really
and Ugellan,
and he says
like Magellan, like Magellan, yeah. So you've been listening to new music?
Well, yeah, because when you put a reel up or something like that, I'll be like, oh wow, like I kind of like that, and like social media has kind of influenced that. But yeah, I am more of a creature of comfort where I'm kind of still listening to the Beatles and like Space Hog, like either 90s music or way
Greg,
before that.
What's that? Space Hog?
Space Hog. Oh man. In the meantime, you'll definitely know what that is. So Dave, I gotta get
Guster and I think Dave Matthews Band.
I'm a Dave fan.
Yeah.
Are you not?
I mean, in high school, I was when I was playing hacky sack and wearing Jesus Cruisers.
That's right. Huge hemp necklaces and all that nonsense. Puka shells.
Yeah. I was going to say that, but I didn't know that was like more than just my school. Yeah.
No, that was us too. A lot of tie dye. Dave, listen, let's get on track here, right? Because this is one of those episodes where you're just going to get, for better or for worse, just going to get our thoughts on a subject. Not a research episode, maybe the first no research episode, but we want you, or at least to give you our perspective on what is helpful when you're trying to figure out how to get the most out of therapy. Whether you're in therapy or you're about to be in therapy, we think it's important.
And I kind of also want to touch a little bit on common questions that people have about therapy or might wonder about therapy. Maybe dabble in a little therapy etiquette.
Oh, I like
both
that.
on the therapist and the patient.
Mm-hmm.
And just overall, like, kind of figuring out, you know, the best way to go about it.
Dave, this is some a metaphor that I can you'll be able to tell that I made it up myself. When I'm thinking about therapy, you got to think about it like you're getting a haircut. You got to know what you want. You got to have an idea of what you want it to look like in the end, right? You have to, so you're knowing the outcome, and during the process, which is important too, you have to be willing to say like, no, that's not really it. That's not really working for me, and make the adjustments throughout. What do you think about that metaphor?
Sure.
Not bad, right?
But like once it's over, and you're screwed and you're stuck with it.
It'll grow back and you can go to a different haircut.
But you are going to have the worst next 4 to 5 weeks of your life.
Yeah. You know, what's interesting is you really do have to be able to, and I'm not sure that I would do it in therapy, because when I used to get haircuts, at the end, when they would show you, when they would say like, what do you think? I would always say I like it, even if I was dying.
1000%. I agree with that statement right there.
Yeah.
I remember like boiling inside, but like, good.
Yeah.
You know,
yeah.
Oh,
you
man.
couldn't even, like, you were itching so bad to just kind of get into the car and like salvage whatever you could, just maybe like move it around a little bit.
I wear a hat pretty frequently, especially if it's just casual. I you know, going to the barber, and I always felt like it's like almost an insult to put your hat on right after you get a haircut, because it's like hiding the brand new haircut. So like, I just remember that feeling of like, I cannot wait till I am out of eyesight and I'm putting that freaking hat on and never taking it off.
Yeah. And I can finally start crying.
So one time, this is funny. Like one time I had to go back and say, this needs to be fixed. He, you know, like at the bottom of the neck, a complete diagonal line. Yeah. Like not straight at all. It was complete diagonal. And when I went back, he goes, I don't see it. Oh my God. Are you kidding?
Yeah, I guess I could go somewhere else. Yeah, here's
I never went to him
weird
again.
So this is interesting. It's like etiquette, right? Like I never knew. So it's been a while since I've been there. When they were like cutting your hair, like so the man is like, I would go to a barber. It was typically a man, and he would like be touching my face and cutting my hair over there. I never knew if it was appropriate to close your eyes or open your eyes. Like I feel like if you close your eyes, it's like it's a weird sort of moment.
So, you know, not in the barber, I would never close my eyes. But
so you just keep them wide open, even though like snipping around your.
Yeah, you know, I think so. Maybe. Oh well, yeah. If you have like bangs or whatever, but I don't have bangs, obviously.
You don't want to close your eyes too long because
it's never happening. I'm never getting bangs in my life, obviously. But at the dentist, I close my eyes. I'm actually one of those weird people that finds getting a dental cleaning very relaxing. And I just lay there with my eyes closed. And normally they don't ever say anything about it. But this last time, the hygienist was like, "Oh, you're tired, huh?" Or like she kept making comments. I'm like, I'm just enjoying it. Like,
you must be an avid flosser, because when I go, it's a bloodbath.
Oh, I'm an avid flosser.
There's nothing fun about it.
Yep.
I feel like they're upset with me. That's what I feel like.
I look for their validation. I'm like, does everything look okay? Am I doing a good job?
People think we're just being insane right now, but we're actually hitting some good points. This is all relatable to therapy. So
absolutely.
Essentially what we're saying here with the haircut metaphor is where we need to know where you are. We need to know where you're going, and we want to find out what's getting in the way. So I think that's the first kind of thing that you want to understand before you get into therapy. Because imagine if a car pulls up beside of you and they're like, "Hey, we need directions." And you say, "Well, where do you need to go?" And they say, "I don't know." Well, guess what? There's no way we can help you, right? So knowing that, like having some idea of where you want to go is very important.
This show is sponsored by BetterHelp.
You know, one of the things I've been thinking about lately is how effective just talking can be.
Yeah, so many of people hold on to things, Dave. We bottle them down. You know, we feel our problems aren't big enough to need therapy, but this is the furthest thing from the truth.
And I know for me, therapy allowed me to have a space to discuss things I hadn't really discussed with anyone before.
That's true, Dave. And I wonder about some of those things you were talking about. It sparked my interest a little bit. But one of the greatest benefits of therapy is having your own space and being able to express whatever it is you've been holding on to.
With how convenient access is in today's day and age, there's absolutely no reason not to try therapy.
Exactly. And BetterHelp is one of the most convenient ways to give it a try. It's completely online and will work around your schedule, so you don't ever have to leave your house.
And the best part of it, if you don't get that tingly feeling from your selected therapist, you can switch it up with no fee.
Or maybe if you do get that tingly feeling, you might want to switch it up. But BetterHelp understands how important it is that you feel connected with your therapist.
So get it off your chest with BetterHelp.
And visit betterhelp.com/nothing today to get 10% off your first month.
That's BetterHelp, HELP.com/nothing. So what you're touching on here, having some idea of where you want to go, that can be really hard sometimes.
Yep.
The other thing a person could do instead, if they're not sure where they want to go, is they could come in with a specific idea of what they want to work on and why that's impacting them.
Okay.
So
yeah, great.
Like, for example, if someone's struggling with depressive symptoms and nothing feels like it's working, and you know they can't initiate anything, they might not see a future, but they know that thing is blocking them from that vision of the future. So they're hoping to kind of, you know, seek some guidance on how to get past that so they can have some kind of future.
Help lift the cloud. So, I mean, in that sense, I would say that the where you want to go is I need some relief from the symptoms. Like that's enough, right? Like like a tangible thing we could start to work on. And also, I guess what we're saying here is like having expectations so that we know, you know, what you want to get out of therapy, so we know how to start creating short-term goals that are going to get you to where you those expectations. Like, or maybe you have these expectations that aren't, you know, reasonable for therapy. Like maybe it's something that, you know, I want to be happy all the time, or I want to, you know what I mean? Like I want to be completely free of anxiety. It's like, okay, well those are some expectations that I don't know if I can sign on, right? So it's like a conversation.
So what we're identifying here is these are the things to kind of think about before you get into therapy. But I think it might even be important for us to even go a step back and say, what even is therapy all about? It's different for each person. And I think that's really important for us to make note of. Like, I think we've had this conversation off air at times because, like, when you're in school, what they talk about therapy being for can look different in the real world. And I think that that's okay. I have some patients who are very driven. They want a ton of homework. They want responsibility. They want to, you know, they're going to do the stuff in the week that you're kind of guiding them, you know, collaboratively guiding them to try to work on. And then you have other patients who maybe won't. They might say they will, and then they're not going to. And you learn to accept that. You kind of see, you know, we've talked about this with patients that we've actually even shared at times, kind of getting to understand people's limitations or you know, how much you're going to be able to push someone before it's kind of like, all right, I gotta just kind of accept this level of where they're at right now, right?
Right. It's also with the people who don't want to do homework or anything like that. That's great too. If you're going to use, like, you can use therapy as a space to just kind of get things off your chest and not have to put it on anybody else. Like, people in your life might not want to hear about all your problems, and where else are you going to go for an hour where it's just about you? No one's going to judge you for just talking just about you for an hour and just getting it off. Like, maybe you're just complaining, maybe it's venting, whatever you want to call it. It's a space for that too.
Yeah, talk therapy is definitely still available, and like it's still very much a thing that I think people can benefit from. And I know that that's I you know what, I don't know, is that maybe that's a controversial statement to make in the therapy world, quote unquote, because I think that there's so much pressure and emphasis on specific techniques these days. You know, everybody's throwing out all these like acronyms like CBT, DBT, ACT, which will explain what all that stuff means. But like, there's just people who want to talk and they want someone to talk to, and they don't have that outlet. So that's really valuable for them. We've both expressed that. Like, sometimes I have to take a step back and be like, because I'll feel like I don't know if I'm helping this person. I feel like I'm not really doing anything. But then, and I had this moment of clarity one day when I asked someone, I was like, do you feel like, we need to continue, or you want to continue this? I kind of just like was vulnerable for a second and said, I don't know that I'm really offering anything to you. And he goes, I absolutely want to continue doing this. I just appreciate having this place to talk. I don't really have any opportunity to talk like this. And it kind of dawned on me like, oh, that's what he's looking for.
Mm-hmm. And it's a lot, and it's really helpful. But that doesn't mean that you're going to get a ton out of therapy if you're not trying, because you do have to make a real effort in therapy. I think you have to be able to, so prepare. I guess another thing I'm saying is prepare to be vulnerable, right? Like, go deep and don't hide things, because that's not doing anybody any good. I guess it's like, what I'm trying to say is, you don't have to impress your therapist. And I don't know if that's coming off in the right way, but I feel like sometimes people won't say like, if I say something and, I think that I'm reflecting them, if I think that I'm understanding them and conceptualizing them the right way, I want to make sure that if that's wrong, say that back to me. Make sure I know that this isn't, that you're not getting me. It's actually more like this. You know what I mean? Like, it's very important to be vulnerable and not to hide things, because if you're not telling us everything, like, you're cheating us both out of, you know what I mean, getting somewhere where we want to be.
I've had multiple patients tell me things or say things like, I'm trying to think of what the statement was. Well, one for sure said, you're like the first therapist that I decided that I was going to be honest with you. And like, you're the first therapist I've done that with. And it was like mind boggling to me. I'm like, why would you lie to your therapist? Like, what do you get out of that? There's no reason to. There's clearly some truth that you're not willing to like discuss, or you don't want to hear the honest opinion about it, or whatever. There's something you're trying to avoid hearing. And now you've decided that you're okay with, you're embracing it. So it's such a weird concept to me. Like, there's really no benefit. It's a waste of your own time if you're not honest.
Well, if that person wasn't feeling comfortable with the therapist, you walk into someone's office and, sometimes you can feel right away like, this isn't going to work. Like, somebody gave me this example of like a therapist they had gone to in the past, where like they were like religious iconography all over the office, and they were like, well, this might not work for me, because this isn't kind of like, they weren't into that sort of thing. So would that bother me? No, I'd probably want to like hear them out and see what they're all about. Like, there's a little bit of a spiritual bend, and I think that's okay. But for some people, that's going to turn people off, and that's okay, right? So I think like, if you get into an office and you're talking to a therapist and you're just not clicking at all, don't be afraid to move on, because you're not hurting anybody's feelings. That's an important thing, I think.
Yeah, it is, something that I'll try to end every initial session I have with just explaining, I would never be offended if you decided that you wanted to, shop around or try another therapist if you felt like this, session wasn't right for you, or you didn't get that spark or whatever. There's nothing wrong with that. We in our professional roles have to be able to embrace that, and we can't allow that to cloud our ability to support people.
Yeah,
it's being selfish if we were to.
Absolutely. And I think that another thing, like, you can even grow past each other too. Like there's been times where I firmly believe that your problems can adapt to your solutions sometimes. Like sometimes your depressive symptoms or your anxiety, whatever interventions you've developed with one therapist, like they can work for a while, then maybe you get stressed, maybe you get tired, maybe something comes up, and your problems sort of adapt to the solutions. Just like any other kind of, it's almost like an evolution, right? They learn to kind of get past that. So maybe finding a new therapist might actually help in that way because you have a whole new set of solutions where there's so much out there. I think that's happened with me before where, I've had a patient where I thought we went as far as we can go and then I passed them on to you. And like maybe, it's a whole different approach. It's a whole different vibe in there.
I've actually been thinking about that a lot lately because I do have a number of patients that I've had for a long time, years. And, you do get to that point where it's like, would they benefit from a different, perspective now that we're at this point? Because they're not the same person I started with, and they've made, the progress that they've made with me. But could they make a different type of progress with someone else? I've been thinking about that actually quite a bit lately.
So haven't I, because we're similar in that way. I think we're the only people in the office that way where we have long-standing patients.
Yeah.
Like years long. Yeah. So I mean,
I appreciate that. I think that's such a great thing. But I do also want them to continue to grow, and I don't want to prevent that growth for them. You know what I mean?
I do. Yeah, I know exactly how you feel. But are we doing that? Or maybe is that our own insecurity? So who knows?
It's probably a little bit of both.
Yeah.
There's a little bit of validity, but also, it's probably our own insecurity of like, oh boy, like now that we've gone this far, what else do I do?
Right. And I also don't want to fall into the traps of, okay, so now it seems like we're, just kind of talking about how your week was. And I don't want to bring up depression or anxiety because the more you kind of focus on those kinds of things, like I don't want to create a problem where maybe there isn't one anymore.
And you know what else I don't want to do? I don't want to just find myself every session telling you how much progress you've made and recapping and rehashing all that progress, because I know at some point you're going to get sick of hearing me say the same damn thing over and over, even if it is positive, right?
Yeah.
And I was kind of finding myself doing that once. I felt like, oh my God, like I feel like the last like 5 sessions I kept reflecting to them how much progress they've made and like, how things have changed, and they're probably done hearing that.
You know what I've been doing?
Maybe they're not. Who knows?
Lately, like an important thing that I think I've been doing, and maybe people can use this before they even go to therapy, is this is sort of something that has been working for me in my own life. And it goes to that, like we're very into like values and choices and all these sort of things. And I think something that supersedes any intervention or is at the sort of baseline of it all, is just thinking this simple thing in your mind, like, the way you're acting, like, am I being someone that I admire? And if you think about that with the actions you make, like exercise and like eating right and all those things, like they're fine with, you can, all the literature and all the evidence points to like they have their reasons why, whatever. But if you take all the biochemistry out of it and you can apply it to almost anything, like if you're mean to someone, if you're not waking up and if you're waking up late to work, or you're not going to the gym, or a million things it could be, but are you being someone you can admire? And if you live your life that way, it's like, it's tough to be depressed, because when you're being depressed, you're behaving in a way that you wouldn't admire. You're like sleeping in, you're not hanging out with the people you used to be. You're kind of lacking motivation. It's all these things that you don't admire. But if you kind of separate your emotions and everything like that and just have that one sort of mantra, am I being someone that I can admire? I think that takes you a long way.
Yeah.
Yeah.
Good one, Greg.
Thank you. Thank you. Thank you very much. So, that goes to something too, Dave. Like, we're talking about, sort of you're bringing up that thing, like, what are we going to get into? I've had someone for so long, right? Like, people get attached to these narratives and they feel a certain way, it's almost like you want to stop bringing up that trauma, whatever it is. Like you had that bad childhood, or people become like married to those narratives of their lives, and it's like, oh, I'm this way because this thing happened to me. But maybe that's like what your relationship with this person was, and maybe they need to move on to someone where it's like that's not part of them anymore. Now they don't want that to be their story anymore, or that can't be their story anymore. Like you're not. It's almost like limiting when you're like, okay, this bad thing happened to me, and I can't do this, this, and this because this bad thing happened to me. And like you get them to a place where they're like okay with that, and now it's like, all right, well now I need to go somewhere else. Maybe that's the end of therapy, when you go figure out, well, what's my new story? You know?
So there is an end of therapy.
Yeah, talk a little bit about that.
So that's a question we get sometimes, and it's one that some people really are anxious for, and then there's some that are really anxious that that day is going to come, and it's such an interesting dynamic. So does therapy end? Yes, I guess it could. It doesn't have to. Insurance probably wants it to. And some schools of theories or theoretical approaches would tell you it's going to. So like we're very familiar with some practices that are very quick paced, hard work. You got to go in, you do the work, and if you don't do the work, then they're not going to work with you, because there is like, it's quick results is kind of what they're looking for. And then you got, like we've talked about many times on here, just what Greg and I do is like that longer road, that more like really looking at like what the individual's needs are, what they're looking for, not really rushing it the process, kind of going at the pace that we feel the patient's looking to go at. If they're not feeling okay with it, hopefully they're giving us that feedback and we either slow it down or we go faster, whatever. But at some point, I feel like you kind of get to, well, what goal are we working towards now? What, is this still necessary? Is this something you want to continue? Do we, we might at first go like, just start going less frequently. And I guess that's another thing that some people probably question too. Like, how often should I go? That's totally dependent on the individual,
right?
And insurance a little bit. So there's some people who might want to go multiple times a week if they really feel it's, things are really, really tough. That's really hard to do. First of all, it's hard to accommodate in this day and age. I know we're overloaded with patients. Actually having spaces on our schedule to be able to see people multiple times a week. Also, it's kind of frowned upon by insurance. So they flag people that get seen too frequently, and they will question. You will have to have a pretty decent like case as to why you're seeing that person so frequently. If there's a risk of hospitalization or any kind of like self-injurious behavior, then that's a pretty good reason you might see someone more frequently. But for the most part, weekly to biweekly is usually, I would say, common starting places.
Well, I think that like what we do, and to give out like not to to be too hard on us for having such long-term patients, is we do those things in the beginning. We'll do the CBT, we'll do the DBT, we'll get rid of those like really scary, dangerous symptoms of depression and anxiety, and like we'll kind of like we'll tone those down for sure. But I think what we do after that is like something that we've sort of both seen together as something that's important, is a lot of people feel like lost, like they don't have an identity, they don't know who they are. And I think a lot of our work after that initial work becomes, well, now that you're feeling better, like, who do you want to be? And, like going through like values and what that looks like. And, that's, and why that doesn't end so quickly is because it's such a moving target, right? The better you get and the more, at ease the relief you get from your symptoms, that target moves a little bit. You start getting a little more confident. You start thinking that there is more and more possibilities for you, and that's a good thing. And we stay with you through that, even though maybe we don't need to be. But it's a good thing to see, right?
Yeah, and also it can take time, because a lot of times that involves making big life changes.
Yeah,
or having really challenging conversations with people who are important, but the relationship needs needs some attention. So, there's a lot of reasons that, that might happen. As time goes along, we might decrease. It could be, every 3 weeks, once a month. That stuff's kind of normal. A lot of my patients tend to stay on biweekly or once every 3 weeks.
Yeah.
But biweekly is probably my most frequent. I do have a number of patients that are weekly. But as we go along, we try to decrease a little bit. And then eventually you might kind of find yourself feeling like you don't need to go.
Yeah. And that's fine too.
That's totally fine. I have some patients that, they might go a month or two before I see them, and then things kind of build up and they come in, we hash it out, and then I might not see them again for another period of time. But if that really starts happening often where they're not coming, it might be time to have that conversation is, do we feel like we've kind of come to the end of a road here? And that's totally fine if so. But yeah.
And something else that with like people who come back is, if you like, this happens to all of us, you could be completely, feel like you're in a place where you don't need to see a therapist anymore. You're good to go. But then like life happens and stress levels go up. Maybe you're not getting enough sleep. Maybe you're not, maybe there's a ton of things going on in your life, and those old symptoms start creeping back in again. It's okay. It's okay to come right back and get a refresher on those interventions.
That is one of the most common things that I see is you work on something with someone, or the person like overcomes this really hard feeling that whether it's like extreme anxiety or, depressive episodes, they start feeling good, and which is amazing. And they're very proud of themselves. They're happy about that. And then suddenly, something in life goes in a different direction and they feel negative again. And instantly they're back to like, oh, I'm there again. It happened again. I'm broken. I'm never going to, it was all, feeling like it was all fake or whatever. And then they get really down on themselves. And then you have to remind yourself, we're human. Yeah. It's not human to not ever feel sadness, anger, frustration. That's not human. The human experience is all about those highs and lows.
Yep.
And over time, the highs don't feel as good if you don't experience those lows once in a while. So
yeah, and that's just one of the harsh truths of life is you are going to experience emotional pain. You are physical and emotional pain. But the beauty is, at a certain point, you get to choose. Well, on some level, you get to choose your pain. Like you're either in a lot of ways. Like you can get in a relationship, and that's going to, me and you could both tell you that can be painful at times, right?
Yep.
Just being in a relationship, but not being in a relationship, that's a painful thing too, right? So like you have to, you'll get to a place where you can decide what like the pains that you want to suffer, right?
Yeah.
It's interesting. So
Greg, let me ask you a few questions.
Sure. I would love that.
Why would I speak to a therapist instead of a friend?
Well, for one thing, it's completely like the therapist can look at you in a way that's completely non-biased. They don't, you know what I mean? They could see things a little clearer than a friend would be able to. Like people have an idea of who you are already. Like I think it's coming into it with a blank slate is a really good thing. Plus, we're sort of, our brains work in a way, not because we're different or special or anything like that, but just because we see it every day, we kind of, it's like we're almost designed to recalibrate your point of view, right? So, plus, maybe your friend doesn't want to hear your shit,
Yeah, well, that's the thing. When you talk to a therapist, there is a level of acceptance of the choices you make. There's that positive regard that we're going to have towards you as our patient, right? And a friend is going to expect certain things when they have conversations with you. If you go in every single week to your friend and you tell them the same story that you've made no progress on, and you just can't make the changes that they're clearly telling you are, very obvious, eventually they're going to get frustrated.
Yeah.
Right.
I mean, it's good to talk to your friends for sure, but they're not paid to kind of carry that load for you. You know what I mean?
And a therapist can be honest without being hurtful.
Mhm.
Like reflect, because they're not they if it's an appropriate therapist, they should have no tie-in to the person's personal life.
Mhm.
So they're not going to be affected by the things that are happening in this person's life, and therefore they can give that feedback in a very non-biased way when needed. A friend a lot of times friends are cheerleaders, right?
Yeah,
They're
absolutely.
gonna like encourage you. You're never wrong. If
Yeah.
you get those friends that like they're
Tell you
just
what you want
always
to
gonna
hear.
have your back.
They're gonna
Exactly.
tell you what you want to hear, and that's that's not gonna get you anywhere. It's gonna keep you where you're at.
But also they have some tie-in to. They could possibly have some tie-in to that, whatever the issue is too. It could impact them as well, so they might have a reason for some of the feedback they're giving as well.
All right, give me another one because I can do better on this one.
Okay.
Let me try again.
How do I know when I should see a therapist?
If you're wondering if you should see a therapist, you should see a therapist.
Yeah.
I think that's kind of a point of view. Like I heard someone say that about alcoholism once. Like, how do I know if I'm an alcoholic? Are you thinking you might be an alcoholic? Well, maybe there's a problem there. I think that's basically the gist of it. Because you don't have to wait until you're in crisis. It's not for people who are quote unquote sick. It's for people who can just see a better path or think that they're worth having a better life, having a better quality of life. No one needs to struggle, just go in there and recalibrate the way you're thinking and feel better maybe than you ever could have. It's just your thought patterns could be off a little bit. It's just so useful. I see it as such a useful thing. I think everyone should kind of do it just as almost like maintenance of their health, just the same way you would go to the gym, you should go to a therapist. I really think that's the way it should be.
Yeah.
It's so important. It's so useful to get those things off your chest.
Agreed.
I know that because I never get to.
What type of therapist should a person go to?
Well, I think that if someone is, on their bio, whatever, very like, I'm a CBT therapist, I'm exclusively DBT or a psychoanalytic, I think that that's sort of limiting. I think you should see someone who, this could be like cultural, like someone you identify with culturally. Like sometimes, like maybe someone my age, maybe I don't want to see an 80-year-old therapist, right? Maybe I don't want to see, maybe if I'm my ethnicities, like maybe someone from one culture would want a therapist in the same culture sometimes, right? They might respond to them a little bit better. They might understand their point of view a little bit better. I think,
that's such a funny thing too, though, because also, and I might get some pushback about this, but I think there's also value sometimes into seeing someone different than you.
Sure.
That could be race, that could be culture, that could be gender. It's really interesting. Like I have a couple of patients that have a history of seeing a number of therapists and it not working. The one thing that was in common with each of those therapists was they were all female. And then they came to me and there's been some longevity there. And I thought that was very interesting because I'm like, clearly there's something there that they're not identifying that is probably an underlying issue, like that relationship to other.
Is this patient a female?
Yeah.
Yeah. Yeah, I've seen that too. I think that me personally, I would prefer a female therapist. What about you?
I've had a male therapist and that was good.
Okay. What that says about us.
Yeah,
but I think like to be a little bit more clear on that question, try people out, right?
Yeah, 100%. And you know what? I have a very diverse caseload. Like my race, culture, genders, sexuality, anything.
You're all over the place with age.
Age for sure. Abilities like cognitive ability. Mm-hmm. And I kind of always, say that like I feel like I could be effective for whoever, but obviously I'm going to have my limitations, right? So I'll be very honest with people, or I'll even sometimes ask if after a period of time, like, what is it like talking? Did you think that this would work? Talking to someone that is nothing like you or anything like that, and just kind of getting their opinions about it. I feel like that helps me grow a little bit when I hear their feedback about maybe some of the things they thought coming into it, or like through the experience. But for the most part, I learn a lot about people because I ask questions. I love asking questions when people are different than who I am. So it helps me learn more. And I think people like that. Maybe that's why it works a lot of times is I'm not afraid to ask questions that, to learn, and they like being able to, share about themselves.
Yeah, no, I think that's good. Any more questions? I think that's fun. It's a fun game.
How do I know if I chose the right therapist?
That's a good question. What do you think?
I think if they come in and they say, "You're the first therapist I'm not going to lie to," that's
yeah, that's how you know. That's how you know.
I have had somebody recently told me that they don't dread coming to therapy since they've started with me, and I was like, "Oh, that's good." So they were dreading it before. That's not a good thing.
Right. I think that, how do you know that you have picked the right therapist? I mean, is your mental health improving? Because I don't think it's just about like liking the person, because that's important for sure.
But also, I do think it's a little bit about that. Maybe not liking the person.
Comfortability. Yeah.
And do you trust the person?
Yep.
And is this person's opinion, maybe not opinion, but guidance, something that's like lingers with you later? I have this situation just came up recently where a patient's sister said, "What would Dave think of that?" And I love that because it was like, clearly then this person, my patient, is talking about my, like, kind of our sessions a little bit with their family. They're sharing things. They're sharing kind of like, they're obviously talking about it in a positive way for their family, even to be able to like say like, "Well, what would Dave think about that?" Or I'll get like, people will say like, "Oh, you should probably tell Dave about that."
Let me ask you this. This is just a personal question. Like, do you put because I put a ton of pressure on myself. I'm constantly like listening to podcasts, reading books, and like just trying to bring something new to session all the time. And I've put a lot of pressure on myself in that way. And, because I feel like that pressure, you could call it anxiety, has made me a better therapist. But at what point can I just say, like, this is what I've got? Like I'm almost afraid to forget how to be a good therapist.
You're doing that more for your own, in my opinion. You're doing that more for your own sake because it's keeping you excited about therapy and being a good therapist versus what you're, because let's be honest, like, you could go to session and be just as effective not having this thing that you just learned that you want to integrate, and you'd be totally fine.
That's true.
Being excited, having new information. I know that like when we do a topic that feeds into also, like, it just kind of flows right into our work. I know I go in with a little bit of like more confidence, I guess, or maybe some excitement, or like, oh, I know how I can tie this in here, and it gives me a spark usually that week.
Me too. It's nice to have something to kind of like something new to kind of work with.
Yeah, but
with people you've been with forever.
But to answer your question, even without that, I think you have enough that you would be, because like the things that are actually helping the person improve is the knowledge base that you already have. It's not what you're learning actively right now.
And I think the earnest we both really want to help people.
Yeah.
And I think that goes a long way. I really do.
I mean,
and for the people, like Hippocrates has this great quote. You can't heal someone until they're willing to give up what made them sick. And people have to understand that when coming to therapy too, because a lot of times, you're in a terrible relationship, or maybe you're drinking too much, or maybe there's a drug issue, maybe whatever it is, maybe you're the way you're talking to yourself or the people you're hanging out with. Are you willing to give up the thing that made you sick?
Yeah.
Because that's going to something with a good therapist, that's going to be found out pretty quick. And
and also to kind of humanize us a little bit so that we're not acting like we're holier than thou.
Oh, not at all.
Because, it's really important to us that we help people. We want to help people, but there's like a lot of reasons that go into that. There's obviously just that's the reason we got into this field. But outside of that, there's like a lot of pressure with this job at times. We were just talking about that. So, there might be a time where someone's paying out of pocket because insurance isn't covering it, and they're paying, a ridiculous, in our opinion, a ridiculous amount of money to come to a session. And it's like, wow, now there's like a physical monetary attachment that's like a number that I know of, that now I'm like, wow, I have to try to offer them that much therapy so that they feel like they didn't just get robbed. And that's so much pressure.
It is. And, there's that, both the idea, like, if you listen to that episode, I forget what the name of it is, but like maybe just the guide to the unconventional therapist, like there's reasons why we've drifted towards this. And it's because we've both struggled. And if you struggled before, then and you found your way out of it, it's like you want to help other people do that too.
Absolutely.
So,
Greg, a couple more questions, but in like a little bit of a different light. Okay. Definitely more opinion. Is my therapist going to judge me?
Well,
I wonder what your thoughts are on this. I'll share mine after.
So I think because they're human, yes, right?
Okay.
But they will not tell you that. Like I remember just, I've had a patient who like had done something that was, really against my values. And did I judge them? Like in my own mind? Yeah, I couldn't help it, right? But, we are going to give like unconditional positive. Yeah. But like you're telling something, if you know that if you're saying something that's sort of, I don't want to say scandalous or like, went against your values and might go against other people's values, like there's getting it out and, having that tense moment, with a therapist is better than doing it with, like a friend or a parent or something like that. And just kind of like, then you can, understand why that happened and the conditions around it and what led you there. And is that who you are? Is that who you want to be? But yeah, I think so in a way.
All right.
Judgment might not be.
Think that's, I think we were just going to say this. I don't think in the realm of like what someone might consider judgment, I don't think that's going to happen in a therapy session. The reason for that is we're in a place, it's almost like going to confession, right?
No, it's like almost, no, you know what? You're right. Because it's almost like scientific instead of emotional for a therapist, where it's like, why did you do that? Not like, why did you do that? You know what I mean? There's a difference there. Like, I want to understand why you did that thing that goes against my values, which you quote unquote judge. I don't know. I'm not judging, but it's like, I want to understand why that behavior happened and, take it from there. It's like going to confession. I feel like the priest does judge you though.
But they shouldn't.
Right.
No, but the thing is, they're coming to the therapy session to talk about it, to be vulnerable. And that right there kind of puts it into a different light. So, I've actually had, I actually kind of currently have a patient going through some stuff, making a lot of choices that would seem very questionable to most. And after he tells me how things are going or what the new update is, he'll often say like, "Oh, you probably think that's terrible," or "Oh my man, you probably think I'm crazy." And no, I actually don't. That thought doesn't go through my mind. A lot of times I'm like, "Wow, I can't believe you got yourself in this." And I'll tell him like things like that. I'll be, we have a pretty good rapport where I can like share some thoughts like, "Wow, I hate to say it, but like kind of saw this one coming."
Yeah.
And he expects that from me, because if I didn't, I wouldn't be being genuine. But I don't feel like there's actual judgment of him happening in my mind, because it just doesn't match the what's happening like in that therapy session. So I don't even think there's like a place for it a lot of times.
Right.
If I was judging, I would be like doing the exact opposite of what I am supposed to be doing.
So I don't want people to get the wrong impression either, because a therapist is going to know not to and make you feel better about judging yourself. So when I say would I judge someone, if someone came to me and was like a mother and they were like really like hurting their kids, or like like actually doing it and not feeling remorse, or like whatever it is, like abuse or sexual abuse, whatever it is, like yeah, I'm gonna probably judge you. But if you're like having some kind of like harm OCD or intrusive thought, like, oh, I'm afraid I'm gonna hurt someone, or like I have these really dark thoughts, like does that make me you're never gonna get judged about that.
I'm just gonna challenge you, because I feel like this is coming off in a way that, like, I'm the way I'm hearing it, it's I kind of disagree with you. I feel like even if a mom came into you and told you, I'm doing these things to my kids, she's in a way, she's sharing that with you for a reason,
right?
Because she wants help with it, hopefully. Maybe she's looking for your guidance, what you think about it. I'm gonna say that rather than judging, you're gonna immediately try to figure out ways to help her stop doing that. And sure, maybe that you're going to pass a judgment, but your main focus is going to be less on she's a bad person, because I bet that wouldn't even go through your head. I bet it would be more like, wow, what's causing her to do this, and how can I support her to help her stop?
Yeah, I mean,
because she's not just coming in and being like, I hurt my kids.
Right. So that's what I'm saying. Like, that's what I'm saying, though. If she was.
But why would she do that?
I don't know.
That's a crazy scenario.
We would judge that.
I would judge that hard, because I'm like, why are you just bragging now?
Yeah, no, yeah,
well, that wouldn't be the point of her telling you. So
I know I get a little bit too like in the weeds, like with possibility, and you know what I mean. Yeah.
All right, on to the next one. That was a doozy. Right. Do I have to talk about my childhood?
Not at all. Not if there's forms of therapy that could care less about your childhood.
Yeah, you don't have to talk about anything.
Yeah, I mean,
well, you have to talk about something, but you're not.
I want to talk about your child. I want to know a little bit about your childhood for sure. I think that's kind of important. But can I treat you without knowing your childhood? Can I just treat your symptoms alone? Absolutely. Yep. That's basically what CBT is. Like, there's no reason to know. Like what happened when you were.
We did the episode on EMDR.
Yep, absolutely.
And you don't even say those traumas out loud to the person working with you. So yeah, you don't have to talk about your childhood, especially if your childhood isn't really the causation of your issue.
Right. Like it could be like, I don't want to talk about my childhood because it's so traumatic, or I dissociated half of it. Fine, that's fine. Or like, my childhood was fine. I don't really need to get into it.
And you know what? If it's just a matter of like, I'm not ready to talk about my childhood yet, that's even better. Yep. I am super patient. I will wait until you are ready, and then we will dig in.
Yeah, we'll wait years.
Online therapy. Or let's put in telehealth, right?
So better than
phone call or online or Zoom or whatever.
Better than nothing. Better help proud sponsor the podcast, right?
Yeah.
So we got to be. Yeah. So absolutely. Like, I think it has its role.
100%. I think it's increased accessibility, which I think is so important, because there are people who weren't leaving the house. There are people who just didn't have time to get to an office. If that's what you want to do, or if that's what makes sense for you to do it. Absolutely.
Yeah. Yeah. We both prefer in person. I think I can speak for you there. I think there's something like about being in the same room that's really, really powerful and absolutely nuanced, and you can pick up on emotions a lot easier. But can you get some good work done with online therapy? Absolutely.
Oh, 100% you can. Yeah. Yep.
We had to. The whole COVID thing.
I was just going to say that we, really started our professions in a time where we had to. And it was crazy, and still is crazy, that there are patients that I've never actually been in person with ever. That's a crazy feeling. But
Yeah, you still have people like that, huh? You never came in
I'm
for a
trying to
hello?
think. Yeah, I have one for sure. I've never seen her in real life. I've only done phone calls. Actually, I know I have a couple that I've only done telehealth with.
Phone calls are like visual.
Both. I have
Okay.
one that I've only done phone calls with. One I've only done. I do like video sometimes and phone calls sometimes. Yeah. Will anyone know I see a therapist?
Only if you tell them.
Yeah. We are not going to tell people. People may see you enter a building if you're doing it that way.
Yeah.
But for the most part, yeah, we're obviously there's been cases where people have been, exposed or whatever, but like don't let bad behavior deter you. We are,
Confidentiality is a
is
hugely
everything.
important thing.
Yeah.
For us. Yeah. And I think it's becoming it's like less and less stigmatized that, therapy used to be like, oh, they had to go to therapy. It's like, it used to be this horrible. When I was growing up, if like a kid had to go to therapy, we're like, oh boy. And now, like, it's everyone should. Everyone should.
Kids are loving it these days.
They love it. They
Yeah.
love, yeah.
Yeah. So I had one more thing.
Okay.
There's this thing that happens at the end of a session sometimes. And actually, the person that requested this episode actually asked about this thing specifically, so I want to make sure I mention it. And I think that I can't remember the exact term for it. Correct me if I'm wrong. The doorknob, is it the doorknob bomb?
Oh yeah.
Is that what it's called?
Yeah. Well, I mean, I don't know if that's what it's called, but I know exactly what you're talking about when they drop something heavy on you and it's like you got 3 minutes left.
Yes.
And you're like, okay.
So that is not the greatest. I think it's super important for someone, if you have a lot of things you want to talk about, or if you have pressing things you want to talk about, make a list when you go in.
Have a journal for therapy and use it in therapy and outside of that. Talking points are great.
Yes. So we call it the doorknob bomb because it's like that visual idea, like as someone's about to leave, they're touching the doorknob to leave the office and they say like, oh, just so you know, this happened. And it's like, what?
Yeah.
And then you don't even have time to process it with the person. That, we want to avoid that, but obviously it happens. Sometimes people space, even in an hour-long session, you can completely forget this thing that you've been thinking all week that you wanted to bring up. That happens. Trust me. Like there's nothing weird about that. That is totally normal. It happens all the time, actually.
No, but that's the importance of having a journal or at least writing down throughout the week the things you want to bring up in therapy. And I think that is the most useful thing, because how many times, like, you could be like, have all these things that you want to talk about throughout the week. Like, oh, this bothered me, this bothered me, this bothered me. And then you get in the room and you're like, I don't even know what I forget what I wanted to talk about. And it's like, it's frustrating for everybody. Right. So having some, get the most out of therapy by being prepared to talk. That's what we're there to do.
The other thing that this person mentioned, and I thought this was a good talking point. She mentioned that sometimes it feels like her therapist isn't listening or paying attention.
Mm-hmm.
And I can understand that. And we are human.
Yeah.
So I would be a bold-faced liar if I pretended I've never zoned out. I mean, I do my best, always, to avoid that from happening. As soon as it happens, I catch it really quick and tune right back in. Some people talk a lot, and need very little room for pause or even someone to interject or talk with them.
Dave's looking out like a cardinal out the window.
There's no good sights out my window anymore, unfortunately. But yeah, no, I mean, but we are listening. And, a lot of times when we are sitting there and you're wondering, we're probably trying to make sure we're paying the closest attention and connecting dots or trying to think of like responses and make sure that we're not missing important details.
But back to the haircut analogy, like if there's something going on during the haircut, the most appropriate thing is to do is to interject there. So what you could do with your therapist is say, hey, sometimes I feel like when I'm telling you something, like you're not really listening to me. That's an awesome moment because maybe you feel like that in other places in your life too, and maybe there's something like getting that across might something might be revealed to you. Actually, this is what's going on, or do you often feel like people aren't listening to you or not really hearing what you're saying? Like it's a good opportunity to address the situation. Maybe the therapist just is kind of like a flaky therapist, and maybe that's not a great fit. Or maybe they're listening, and for whatever reason, you're worried about that because it's happened in the past. So who knows, right? It's a good talking point for you and your therapist to sort of dig into, and your therapist is not going to be offended.
If it's to the point where you're noticing it frequently, you should address it.
Yeah,
because
are you sleeping?
Yeah. It might be just who they are. It might be the way that like their face when they're paying attention looks like that. I don't know. It could be anything, but it's worth asking. And like, like Greg said, like kind of make a comment about it just to see what their response is. That's interesting.
And then if they don't answer you, then they weren't listening.
So yeah, I thought that was a good one because I bet people ask that or wonder that. So there's some like stereotypes of what a therapist or a therapy session looks like, and like people always think about like the couch, and like that's like a very Freudian thing, I guess. Right? Yeah. Like the couch, someone laying down. Like our offices aren't set up like that. I mean, I wish I had a couch. But
no kidding. I was just gonna say, like, are you kidding me? Yeah. I was almost thinking like some bean bags on the floor and just kind of like really just kind of get into it.
And incense.
Yeah. Now that'd be nice, but we don't have a lot of space.
No. So we just have kind of like chairs set up and set it. I tend to sit a little bit diagonal from the individual, not directly in front of them. That's intimidating.
Mm-hmm.
And I leave a little bit of space. Some people sit a little bit closer. That's fine. I also think some of that is because do you leave a little space or are you kind of close?
No, I leave a ton of space. And then, but if it's like getting really like heart to heart,
yes, you get a little closer.
A little bit.
Yeah. That's why we do it.
Yeah.
And because we're males.
That's right, dude.
We have to, but that is honestly a conscious thing that we probably think about. Like,
yeah,
I'm not going to get too close to this person. They might get uncomfortable.
Yeah, absolutely.
But you're right. That little roll in move when,
it lets you know, like our person who asked the question, it lets you know, I'm with you right now.
Yeah. Body language is everything. And that's another thing. If your therapist isn't giving you good body language in moments where they should, that's that's another way to tell if they're listening. I know that like when someone's getting distressed, I do the lean in.
Mm-hmm.
And that's, I don't even think about it. That's just natural.
Yeah.
If you don't lean in, I feel like maybe you're not being in the moment as a therapist, right?
No, you gotta get right in there. Yeah.
You have to use the body, your body language, energy. That stuff's all super important to make help a person feel supported. So yeah, that's kind of a few things that you might expect. The other thing is like note taking during sessions. I picture Greg, you being a note taker.
Oh yeah, dude. And people have like certain people will ask about it. Like, what are you writing? It's like, well, here's the thing.
What do you say?
And I'll tell him exactly what I'm writing. I'm saying you said something there that I find like important or fascinating, and I'm gonna write it down because I don't want to interrupt like whatever you're on right now, and I want to be able to come back to it without me forgetting. So and that's literally what I use notes for, and I also use it for I'll have some notes on, maybe I'll mention like family, relationship, work or school, whatever, friends, like the important real categories that I want to get into, like stressors, goals, like just to make sure I'm kind of Because and then that way, if I have that notepad and I have those notes down there, I can really engage with you. So it's not a disconnect. It's more like my tool to be able to engage with you and not worry about forgetting the things that I wanted to mention to you.
I am the exact opposite. I'm not a note taker at all. I rarely do, but if we're having a conversation and I want to jot down something, I'll grab the notepad next to me or something like that. But for the most part, I often am not writing notes except on like an initial appointment.
I'm constantly writing notes. Even when we talk on the podcast, I'll write down things.
I know.
Yeah.
I see you do it. I hear you flipping your pages. I don't know how I feel, and this is just me being a little old school and like kind of crotchety, about laptop use.
I hate it.
Yeah.
That's inappropriate. Typing?
That's inappropriate.
No, I feel like that's way too medical. I mean, you're typing away when someone's telling you something.
Yeah.
That's weird. Like
I think some people can pull it off, but I've seen people who can't.
Yeah. You know what, though? I have to say, though, the only time I'll ever use it is like an intake. I'll use it.
Yeah, I do on an intake too.
Yeah, and that's it.
Because you got to gather information. But intake, so that's the other thing. An intake, a first session, an intake session, we're just gathering information that day. So we're going to ask you everything that's on our intake packet, which is like, your family, your living situation, what you're experiencing. So that day is very minimal dialogue, but I'm sure you're the same way. I can't help myself sometimes.
I always get dug in. Yeah. And I'll tell them, I'm like, look, you're going to say things. And this is true about the intakes. You're going to say things and it's going to feel like I'm glossing over very important things, but I'm not. We're going to this isn't therapy yet. This is information. So yeah, no, you know what? And the most important thing is go to therapy. Just go to therapy.
Give it a try.
Give it a try because it's really even if you have a therapist who's not a perfect fit for you, because some places maybe you're not able to switch as easily, in some parts of the world too. Like you wait on a list, boom, that's your therapist, you got to deal with it. The place where you can just kind of talk about yourself for a little while and let that stuff get those thoughts out of your head and into the air, and it's a good process. It really is.
So if you're in Rhode Island, come to Quality Behavioral Health.
Hey, there's a free ad or what?
Visit Dave and Greg.
Yep, come on in.
If you're not in Rhode Island, go anywhere else. I don't care. Go somewhere.
Yeah. Or subscribe and wait, what do we do? Rate and review.
And we got more fan mail this week, which I just really quickly will go over. But yeah, that's a cool new option that is on there as far as being able to be interactive. People can drop little lines on the fan mail thing. I think it's right on wherever you're streaming this. I think there is send a message or something like that as an option. So this is our second one. This is very cool. This person, I believe, is in Ontario.
I didn't see where it was from. And I tried to respond back, but I don't know how to do that either.
Thorold, Ontario, I believe. ON. Okay. ON would be Ontario, right?
Oh, yeah. Well, Canada, you mean?
Yeah, I don't know. Anyways, there's no name on these, so unfortunately we can't give them the shout out, but big fan of the podcast. I don't see a way to rate it on Spotify, but you guys get 5 stars from me. You know what? Just you saying it means the world, so that's awesome. Thank you so much. Yeah, it's cool that people are able to connect in all these different ways. So thank you. But yeah, as Greg said, we have a subscriptions page. Please check that out if you'd be so kind. We definitely appreciate all the support, and to the people who already subscribed, we hope that you continue to enjoy the show, and that, as we always mention, people can reach out to us, social media, the new fan mail way, utgnpodcast@gmail.com is our email. We do get a number of people who email us, and we're always looking for input, episode suggestions. That's actually what today's was a recommendation by a listener. So this is cool. It's cool to be able to have people say, I would love to hear you guys talk about this, and then we just go to town. So
Go to town.
Feel free to do that. And as Greg also mentioned, if you can leave a rating and review wherever you stream this, it's greatly appreciated. We do really enjoy that, but also we like being able to read the reviews on here and give the person a shout out, because it is the reason we do this, is to, you know, reach everybody and hopefully make an impact. So thank you.
Yes.
And hope everybody had a good Mother's Day, and have a good week. Weather's getting a little warmer. Enjoy it. Right, Greg?
That's right. Get in the sun. That's actually really good for you.
It is. But put sunscreen on.
That's right.
That would be really bad for you.
Yeah.
All right, everybody. We hope you have a wonderful night. We will see you next week. Bye-bye.
Bye-bye.